What if your body was quietly warning you about prostate cancer and you didn't even notice? Most men ignore the early signs, thinking it's just part of getting older, but that silent mistake could cost you your life. In this video, we're revealing 7 early warning signs of prostate cancer that every man should know before it's too late. These symptoms may seem small, but they could be your first clue that something serious is going on. Stick around, because knowing these signs could save your life, or the life of someone you love. First, we have difficulty starting urination. Difficulty starting urination is one of the earliest warning signs of prostate cancer that men should never ignore. The prostate is a small gland located below the bladder and surrounds the urethra, the tube through which urine flows out of the body. When prostate cancer begins to grow, even in its early stages, it can press against the urethra or cause inflammation. This pressure can make it harder to start the flow of urine, leading to hesitation or a delayed stream when trying to urinate. This change in urinary habits may seem minor at first and can easily be mistaken for a normal sign of aging. However, the key concern is that the growing tumor can interfere with the normal function of the urinary system. As the prostate becomes enlarged due to the presence of cancerous cells, it disrupts the smooth passage of urine from the bladder. This can make a man feel like he needs to strain or wait before urine begins to flow, even when the bladder feels full. Difficulty starting urination can also be accompanied by other symptoms such as weak urine stream, dribbling at the end, or the need to urinate more often, especially at night. These symptoms often occur gradually, making them easy to overlook, but their slow development doesn't mean they aren't serious. Prostate cancer in its early stages often doesn't cause pain, so changes in urinary function may be the only visible clue that something is wrong. Many men delay seeking help because they feel embarrassed or assume it's just a normal part of getting older. However, early detection is critical. When prostate cancer is found early, it's much easier to treat and the chances of survival are significantly higher. Paying attention to unusual changes, like trouble starting urination, can make all the difference in catching the disease before it spreads. If you or someone you know is experiencing difficulty starting urination, it's important not to ignore it. While other conditions like benign prostatic hyperplasia, BPH, can also cause similar symptoms, only a medical checkup can determine the exact cause. Regular prostate exams and open conversations with a healthcare provider can lead to early diagnosis and better outcomes. Recognizing and acting on these early warning signs can help save lives. Next, we have erectile dysfunction. Erectile dysfunction, or the inability to achieve or maintain an erection, can sometimes be an early warning sign of prostate cancer. While it's commonly linked to aging, stress, or cardiovascular problems, it's important to know that prostate cancer can also interfere with sexual function. The prostate plays a crucial role in male reproductive health, and any abnormal changes within it can affect the nerves and blood vessels responsible for erections. As prostate cancer begins to develop, it may press against or invade nearby tissues, including the nerves that help control erectile function. This interference can disrupt the normal signaling that allows blood to flow into the penis, leading to difficulty getting or keeping an erection. In some cases, the tumor itself may not be directly responsible, but the stress and anxiety caused by early cancer-related symptoms can also contribute to sexual performance issues. It's also possible that inflammation or other changes in the prostate caused by cancer may impact hormone levels. Since testosterone and other hormones play a key role in sexual health, even subtle changes can lead to erectile dysfunction. Men may notice a gradual decline in their ability to perform sexually, and while this may not seem alarming on its own, it could be a red flag when paired with other prostate-related symptoms. Many men hesitate to discuss sexual problems with their doctor due to embarrassment, but doing so could lead to a life-saving diagnosis. When erectile dysfunction occurs along with urinary issues, pelvic discomfort, or unexplained fatigue, it should prompt a closer look at prostate health. Early detection of prostate cancer gives patients a much better chance at effective treatment and recovery. Ignoring changes in sexual health can delay diagnosis and allow cancer to progress unnoticed. That's why any unexpected erectile problems, especially in middle-aged or older men, should be taken seriously. A simple medical evaluation, including a prostate exam and PSA test, can offer peace of mind or catch the disease early. Addressing erectile dysfunction promptly can protect more than just your sex life, it could save your life. Next, we have frequent urination. Frequent urination, especially at night, is one of the earliest and most noticeable warning signs of prostate cancer. The prostate gland sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. When cancer begins to develop in the prostate, even in its early stages, it can put pressure on the bladder or urethra. This pressure makes it harder for the bladder to empty completely, causing a man to feel the need to urinate more often. As the tumor grows, it can irritate the bladder or block the normal flow of urine. This can lead to a constant feeling of needing to urinate, even shortly after just going. Some men may wake up several times during the night with an urgent need to go, a condition known as nocturia. While this symptom can also be caused by other prostate conditions like benign prostatic hyperplasia, BPH, it should not be dismissed, especially if it appears suddenly or gets worse over time. The frequent urge to urinate can become frustrating and disruptive, affecting sleep and daily activities. It may also be accompanied by other signs, such as a weak urine stream, a sense of incomplete emptying, or even slight pain during urination. These changes in urinary habits are signals that something may not be functioning properly within the prostate and should be evaluated by a healthcare provider. Prostate cancer in its early stages often doesn't cause pain, making urinary symptoms one of the few early clues. Many men delay seeing a doctor because they believe frequent urination is just a part of aging. However, early detection of prostate cancer dramatically improves the chances of successful treatment, and recognizing symptoms like increased urination can lead to earlier diagnosis. Next, we have incomplete bladder emptying. Incomplete bladder emptying is a warning sign that something might be wrong with the prostate, including the possibility of prostate cancer. The prostate gland is located just below the bladder and surrounds the urethra, the tube that carries urine out of the body. When cancer starts to grow in the prostate, it can press against the urethra or cause inflammation that affects the normal flow of urine. As a result, the bladder may not fully empty, leaving behind urine even after going to the bathroom. This leftover urine can create a feeling of constant fullness or the need to urinate again soon after finishing. It may also lead to frequent bathroom visits, especially during the night, disrupting sleep and daily activities. Many men may overlook this symptom or assume it's just a natural part of aging. However, the inability to completely empty the bladder is a signal that the prostate might be enlarged or affected by cancer cells that are interfering with urinary function. Over time, if the bladder cannot empty properly, it can become stretched or weakened. This can lead to more serious urinary problems, infections, or even kidney damage. The early stages of prostate cancer often go unnoticed because they are not painful. That's why subtle symptoms like incomplete bladder emptying can be crucial clues that prompt further medical investigation. Men experiencing this symptom might also notice a weak urine stream, hesitation before urination begins, or a stop-and-start flow. These are all signs that the prostate may be putting pressure on the urethra. While conditions like benign prostatic hyperplasia can also cause these symptoms, prostate cancer must be ruled out through proper testing and medical evaluation. Next, we have painful ejaculation. Painful ejaculation is a symptom that many men may find alarming, and it can be an early warning sign of prostate cancer. The prostate plays a key role in producing seminal fluid, which mixes with sperm during ejaculation. When cancer begins to develop in the prostate, it can cause inflammation, irritation, or even structural changes within the gland. These changes can lead to discomfort or pain during ejaculation, which should not be ignored. As prostate cancer grows, it may affect the nerves and tissue surrounding the prostate. This can create pressure or inflammation that disrupts the normal function of the reproductive system. Pain during ejaculation might feel like a burning sensation or sharp discomfort, and it can happen occasionally or become more frequent over time. Some men may also experience pain in the perineal area, the region between the scrotum and anus, which can be a sign that the prostate is under stress. Painful ejaculation can also be linked to other symptoms such as pelvic discomfort, blood in semen, or difficulty with urination. These signs, when seen together, may indicate a more serious issue with the prostate. While painful ejaculation is less commonly discussed than other prostate-related symptoms, it's still a significant signal that something may be wrong, especially if it appears suddenly or without any clear cause. Next, we have painful urination. Painful urination, also known as dysuria, can be an early warning sign of prostate cancer that shouldn't be ignored. The prostate gland surrounds part of the urethra, the tube that carries urine out of the body. When prostate cancer begins to grow, it can put pressure on the urethra or cause inflammation in the surrounding tissues. This interference can lead to a burning sensation or discomfort when urinating, which may gradually worsen over time. As the tumor enlarges, it can obstruct the flow of urine or irritate the bladder and urethra. This irritation often triggers pain, especially during urination. While many men associate painful urination with infections or kidney stones, it's important to consider that prostate cancer can also be the underlying cause. In some cases, men may also notice a slower urine stream, urgency, or difficulty starting and stopping the flow alongside the pain. The pain may not be constant but can occur more frequently as the cancer progresses. It might feel like a sharp or burning sensation and could be mistaken for a urinary tract infection. However, if painful urination occurs repeatedly or is accompanied by other unusual symptoms like blood in urine or semen, it should be taken seriously. These signs can point to changes within the prostate that require medical attention. Last, we have weak urine stream. A weak urine stream is often overlooked, but it can be an early warning sign of prostate cancer. The prostate gland surrounds the urethra, which is the tube that carries urine from the bladder out of the body. When cancer begins to develop in the prostate, it can start pressing against or narrowing the urethra. This pressure restricts the normal flow of urine, causing the stream to become weak or interrupted. Men experiencing a weak urine stream might notice that it takes longer to empty their bladder or that the flow of urine stops and starts. These changes may seem like minor inconveniences at first, but they could indicate that the prostate is being affected by something more serious, such as a tumor. As the cancer grows, the blockage can become more pronounced, making it even more difficult to urinate normally. A weak stream may also come with other urinary symptoms, like straining to urinate, dribbling at the end, or a feeling that the bladder hasn't completely emptied. While these symptoms are also common with benign prostate enlargement, they should never be ignored, especially if they appear suddenly or get worse over time. Prostate cancer in its early stages often shows up in subtle ways, and urinary problems are among the first clues.